Our next guest is Professor Ashraf Coovadia, pediatrician, academic head of Department of Pediatrics and Child Health at Wits University. And I'm speaking to Ashraf in response to, or as a follow-up to, an article that he penned on Daily Maverick last week with the headline, "Climate Change is Already a Global Health Crisis, Not a Future Concern." Ashraf Coovadia, very good afternoon. Thank you for your time.
Thank you very much, John.
In what ways is it already a global health crisis?
Well, I'm sure the listeners will recognize that there's extreme weather events that are occurring around the globe at any point in time. And there's no doubt that many of these are now climate change related as a result of climate change. And, so there's large numbers of people that are already affected through these extreme weather events, not just dying from, being in floods or fires and hurricanes, that sort of thing, but also large numbers and populations of people displaced from their homes as a result of it. So those are very direct impacts of climate change being felt on human health.
Are there more systemic health, not health threats, but health realities as a result of climate destruction?
Oh, yes, absolutely. So we've known, there's a lot of literature now that's been building up for a very long time. More than a decade now, that we can say that we're seeing very clear indications that respiratory illnesses are on the rise as a result of the climate, impact of climate change on air quality, for example. Pollen seasons are changing around the globe because of increasing global temperatures. Ground ozone layers. So this ground ozone is very different from the atmospheric ozone that actually helps to protect us from UV light. But the ground ozone concentrations are actually more harmful and increase individuals' respiratory problems, right? So there's those impacts already that are being felt. If I can go on to tell you about, infectious diseases like malaria, that ecology is changing just because it's becoming warmer in different places. So at higher altitudes than we would have seen previously, where malaria, the mosquitoes weren't able to survive in those regions, are now able to thrive. And so you're beginning to see malaria in areas where we didn't see malaria. And dengue fever, which we don't see in South Africa, but in other parts of the continent is a reality, is now in wider areas than it was before. So those are just some examples of how climate impacts, as I said, systemic issues that result in health impacts.
And complicating the absence of a coordinated and properly forceful response to this, Ashraf, is that there is a trend at the level where policy decisions can be made and enforced of climate change denial. More and more political leaders are coming into office who either downplay or completely negate the threat of climate change.
Absolutely. One just has to look at what's happening in the United States, who should be leading the world in climate change actions. One of the largest polluters and largest contributors to the carbon footprint of the globe is actually behaving as if they're climate deniers, unfortunately.
So what can be done to begin to meet the challenges posed by what is already happening and how it potentially might worsen, while at the same time operating in an environment where there is less political cover and support for those efforts?
We're lucky in South Africa in that we're not having such pushback, and I think our government actually are sort of in support of working on climate change mitigation strategies to try and deal with it. But unfortunately, it's a race against time. And I believe that, once our government is trying to do something about climate change, it's not doing it fast and wide, involving many sectors and not just agriculture and forestry, which is where they placed their sort of emphasis on health doesn't seem to be even talking about climate change, and yet it has a huge impact on human health. So what do we do? I mean, the first step, John, I guess, is more of this sort of thing, more making the public more aware of the fact that climate change is not a distant thing. It's not even something that we should be debating. It's not a controversial issue. All scientists around the globe agree on this issue. But now, what do we actually do? Get the public more aware of it. Get the public to start to realize that there's certain behaviors that we as a society can start adapting, and can have an impact on the amount of carbon we're putting into the atmosphere.
Thank you very much for sounding the alarm bells in this way, Professor Ashraf Coovadia, who is the head of Department of Pediatrics and Child Health at Wits University.